And this month is Endometriosis Awareness Month. It is known as a painful condition affecting an estimated 1 in 10 women. Join me now to discuss a free public education event this month is patient Lindsey Morando and Sharp Memorial surgeon Dr. Chandra Spring-Robinson. Thank you so much for being here, Lindsey and Dr. Spring-Robinson. This is such an important topic. We are honoring so many women that are going through this at this time. And I'm going to start with you, Lindsey. You are a patient and you were diagnosed with this condition at such a young age. Take us back when you were a teenager.
Yeah, definitely. Well, I actually, growing up, I always had horrible periods and cramps, and I just thought that was normal. My mom actually had an ongoing joke that she knew every 30 days she was going to have to pick me up from the school nurse's office because I was going to have cramps. And, I went through different doctors and just thought that was normal, so I just kind of went about life like that. But, yeah.
And what type of treatment did you receive during this time?
So none. Mostly it was just put on pain meds, prescription pain meds, and birth control. That was it. I didn't have a diagnosis. It was just that was normal.
So at what age were you when you're saying, okay, this is pretty serious, these symptoms are getting really severe, and when did you get in touch with Dr. Spring-Robinson?
Yeah, well, flash forward many moons later. So my late 30s, I started to have severe bloating, and I thought, this is not normal. Something's off here. I'd wake up bloated, I'd go to bed bloated, I tried every detox protocol, nothing worked. And I finally talked to a friend that had similar symptoms, and she had seen Dr. Spring-Robinson, and she said she raved about her and said it was amazing, and she had finally gotten an endometriosis diagnosis, which I thought, I've never heard that term from any of my doctors.
What is endometriosis?
So endometriosis is tissue like the inside lining of the uterus growing outside of it. And this causes severe pelvic pain, bloating, and even infertility. And it's a lot more common than we realize. It's 1 in 10, like you said, but it often takes at least 7 to 10 years for a diagnosis.
What type of surgery did Lindsey get?
She got robotic excision surgery, and that's where we can actually remove the disease at its root and therefore leave her basically with a nice blank slate with no disease, and that way she can get her life back.
Is it removed?
Yeah.
How are you feeling
You did an
today?
amazing job.
How are you feeling today?
Oh, so good. I feel like I have my life back. My bloating is completely down. My anxiety that was through the roof is completely gone. I just feel like I got a second chance at life. I feel amazing.
You think about it, during your menstrual cycle, you do get the bloating, the cramping, and it's so uncomfortable sometimes.
What makes you realize you may have endometriosis is when you start scheduling your life around your period, where basically you stop going to work events and friend events because of the amount of pain you're in, because of the amount of bloating you're in. Also, it can be severely anxiety and depression riding. So that's when you should start seeking help.
What would you say to parents right now that are listening to this and Lindsey's message?
So I think what happens is that it's been normalized, that this is one of those things that I went through, so you're going to go through. And unfortunately, what's occurring is that with this normalization, people aren't getting diagnosed and treated earlier.
All right. Another question for you. Can this tissue expel from the woman's body? I know there are so many stories about people wondering if the endometriosis tissue can expel and detach from the reproductive system.
Well, no, because basically the inside of the uterus is the lining of the uterus, and that's just the normal tissue. This is a chronic inflammatory disease where that tissue like that actually grows inside of the pelvis, so it cannot expel. It just continues to grow and scar and grab onto other tissue, which causes the pain.
All right, this is so interesting. So there's also a free public event coming up on March 28th. How can people attend and get involved?
So on March 28th, and with Sharp, we're doing an event where we're going to have multiple different physicians, and it's a free event, and we'll have gynecology, urology, pelvic pain, gastroenterology, colorectal, pelvic floor therapy, acupuncture, and you just need to sign up online.
All right, Dr. Spring-Robinson and Lindsey, thank you so much for being here, raising awareness on endometriosis. We appreciate it.
Thank you so much.
Thank you.